you both have such an extensive background in addiction treatment. I'm curious, how would you define successful addiction treatment in your experience?
I mean, I think for me, the way I define it really starts with how the patient defines it, right? So when we are setting up working with patients and setting goals and treatment plans, is really determining what does the patient how do they define success, and sometimes our definitions may be convergent, but it's the patient's treatment, right? And we're working on their treatment plan, and so I define it by how well somebody is doing in terms of reaching the treatment goals that they established at the start of their treatment. And also recognizing that during the course of treatment, those goals may change. But really, how well somebody is doing in terms of progressing along and making progress towards the goals that they set for themselves.
And Dr. Jarvis, I mean, same question, but I would also ask, in your opinion, what are some of the primary goals of addiction treatment from your perspective in a general sense?
So I'm with her, and but also I think there's an from the providers, whether that provider is a physician, an advanced practice provider, a counselor of some stripe, we have a very clear obligation to make sure that we are diagnosing people very carefully and providing appropriate evidence-based information about the likely progress of the disease, treatment options, and then negotiating with the patient about what might be available to them in terms of treatment and where that's likely to get them. And if both both parties can come to that treatment with that kind of clarity, things go better. Things just go better.